have Dr. Magada, who's our physician. We have Muli Musioka, who's a trichologist. And we have Bidanya, who's here to share her story. And we have Irene Musa, who's the nutritionist. So I think we'll start with Dr. Magada.
If somebody in your family has had a certain lifestyle disease, chances are very high that you will develop that lifestyle disease. Now, unfortunately, we cannot alter family history. You can't change where you were born. And you should thank God having been born where you were born. So family history. And we know this from breast cancer, for example. If your sibling or somebody in the family has had breast cancer, chances are very high that you will have breast cancer. Diabetes, the same thing. Hypertension, the same thing. Cancer of the prostate, the same thing. Now, risk factor number 2, that is non-modifiable, is age. As you grow older, you are at risk of developing lifestyle diseases. Your organs start slowing down. Your immunity starts changing. If you look at, talking about organs slowing down, if you look at diabetes, as you grow older, your pancreas reduces in function, especially the beta cells that produce insulin, which deals with sugar in your blood. And deficiency of this insulin then will lead to diabetes. Another risk factor that probably we can't change is gender and race. There are certain lifestyle diseases that occur more in certain gender than others, and in certain races than others. For example, cancer of the skin does occur more in light-skinned individuals, especially the whites, as opposed to the blacks. Cancer of the prostate tends to occur more in blacks as opposed to whites. So these are things that you can't do much. You can't change your race. And some of these risk factors out of lifestyle choices include sedentary lifestyle. Exercise helps improve your immunity. Exercise gives you a sense of well-being. You feel, yes, I can live longer. Another choice, lifestyle choice, that puts us at risk of major lifestyle diseases is tobacco use. Something that must and should be avoided if we want to prevent lifestyle diseases. Cancers of the mouth, the major risk factor is tobacco use. Cancer of the throat, the major risk factor is tobacco use. Cancer of the esophagus, the major risk factor is tobacco use. Cancer of the stomach, the major risk factor is tobacco use. Alcohol. Alcohol does have some advantages. It's a social drink. There is a study arising from the French paradox, which says, states that moderate amounts of alcohol are good for your heart. Moderate amounts of alcohol mean up to 2 bottles of beer every day, or a glass of wine every day, or 2 totes of brandy. This is moderate amounts of alcohol, and this is what is likely to be helpful. Alcohol is a risk factor for heart disease. Alcohol is a risk factor for cancer of the liver, cancer of the stomach, cancer of esophagus. 2 weeks ago, we buried a friend of mine who had a rupture of esophagus after drinking alcohol. He drank alcohol, then vomited, developed what we call Mallory-Weiss syndrome. You don't have to mention some of those syndromes so that you notice the difference. Diet, and the nutritionist is here to tell us more about diet. But from a physician's point of view, a diet that is high in fat and high in refined sugars predisposes you to certain diseases like cancer of the breast, cancer of the colon. These are things that you must avoid. Diabetes, you know. Yes, a high fat diet tastes sweet. A diet that is high in refined sugars tastes nice, but then it puts you at risk of major lifestyle diseases. So diet, very important. Stress. It is very important that we manage stress, because stress is a major risk factor You cannot avoid stress because stress is what makes us move. Rest, adequate rest is very important as a stress management tool. Another important thing in stress management, of course, in addition to good diet and exercise, is doing things that give you an inner meaning and a peace of mind. That takes care of your spirituality. A human being is a spirit, a soul, and a body. And anything going wrong in the spirit will affect the soul and the body. Anything going wrong in the body will affect the spirit and the soul. Anything going wrong in the soul will affect the body and the spirit. The soul here is equal to the mind. And that's why we say people must be very careful what they feed their minds with. Because then that can be stressful. Now, management of stress. Meditation, prayer, very important things in stress management. The final thing about risk factors for lifestyle diseases is infections. There are certain infections that are associated with certain lifestyle diseases. For example, it is thought that probably prostate cancer could be having an infective agent as a risk factor. Hepatitis B is a risk factor for cancer of the liver. You know, HIV is an infection that is a risk factor for many other things. When it reduces your immunity, then you're more susceptible to cancer. There are several things you should do to prevent lifestyle diseases. One, drink enough water. How much is enough water? I know many people talk about glasses, 8 glasses, 5 glasses, 12 glasses. From a practical point of view, I choose not to say the number of glasses. I choose to say, look at your urine if you can. I remember there was a lady, elderly lady, I asked, what is the color of your urine? And she was very surprised. I don't even see my urine. How would I know the color? But for the men, it's probably very easy. So look at the color of your urine. If your urine is dark, then you're not taking adequate amount of water. Make sure your urine is clear. So taking adequate amount of water is good in preventing lifestyle diseases. Exercise. And when we talk about exercise, we are talking about jogging, brisk walking, bicycling, swimming, dancing. Those are the exercises that would be helpful to your body. Isometric exercises like weightlifting and press-ups and all those, these are bodybuilding exercises, not necessarily good in terms of lifestyle disease prevention. Make sure that you get immunized against those illnesses that could put you at risk of developing lifestyle diseases. Thank you very much.